Hi, Dr. Baumholtz, Baumholtz Plastic Surgery. I want to talk about brachioplasty or arm lifts, right? So people that lose a fair amount of weight often have excess skin, right, along their arms that they'd like to deal with. I want to think of the arms as two components. We've got skin and fat. We're going to manage the fat component with liposuction and the skin with excision. And let's first define some terms. So the arm will divide, let me get into the frame here, as a 1/3, a 2/3, and a final third. If the problem is in the first third, we may get away with doing an operation known as an axillary brachioplasty where the scar is contained within the armpit. Typically it goes beyond that, and if that's the case, we'll do a traditional excision where the scar goes from the elbow, sometimes even beyond the elbow, all the way up to the armpit and then down to where the base of the breast meets the body. That's going to give us the opportunity to remove some of this excess skin here. Now, this is not breast tissue. This is tacos and donuts, I'm sad to say. And it's not back tissue either, but we're going to use that to clean up some of the excess skin of the back, to clean up some of the excess skin here, and to provide a nice transition from the arm to the body wall. Now, brachioplasty has a bad rap in terms of the quality of the scars, and mine really aren't different, and I'm going to explain why. It has to do with the quality of the skin of the inside of the arm. So you may have noticed that the inside arm skin is typically very thin, even more so if you've had significant weight gain and loss. That means it doesn't have the durability to take and hold a stitch well. This is where we get the wider scars. Now, not everybody and not every time, but it's something that happens often enough. I'd like you to be aware of it. We're going to trade scars for contour. So when your arms are at your side or when you're wearing a sleeved outfit, your arms will fit better in clothing and you'll feel more confident about the shape of your arms. But we can't do that. We can't remove the skin without surgery. So all of the creams and salves and non-surgical anything is not going to solve it for you. Trust me, if somebody found the right machine that's going to shrink wrap skin, we would all abandon surgery and we would do that. Sadly, it doesn't exist yet. So if you have excess skin, we got to cut it out and then sew it closed, and then you and your genetics are going to do the healing. If you would like to know more about a brachioplasty and which version of the brachioplasty would be right for you, come see me in consultation. I'm Dr. Baumholtz and I look forward to meeting you. Thank you.